The opioid crisis is reaching record numbers. You hear about it on a daily basis. More and more families ripped apart by addiction and by overdose. Federal officials have now called it an epidemic. According to the CDC's latest numbers, 40% of opioid overdose deaths happen to someone with a prescription. Overdose is happening most among people ages 25 to 54, and at least 17% of Americans have had at least one of these prescriptions filled, so many are facing some level of risk. Joining us this morning to talk about it is Dr. Vivek Iyer from the Cancer Treatment Centers of America with some of the options that are being approached nowadays for managing pain. And it's obviously such an important conversation because doctors really have to face the potential consequences that you never know if your patient is somebody who is at risk of addiction.
Yeah, absolutely. I think patients may have their own risks of addiction prior to ever having a prescription written for them. But I think what they're finding out more and more is even a situation as what seems harmless, like having a surgery and getting a prescription afterwards. There's a lot of research coming out from Stanford, from the University of Michigan, that prescriptions after surgery can lead to chronic opioid use.
So do you think part of the problem is a willingness to maybe write those prescriptions for too long a duration or not even considering any other approaches?
Yeah, I think one of the issues is that it is easier to write a prescription. There's time pressures to get through a visit. And so I think taking the time to really try to find out why is somebody hurting and providing them with options, whether it's physical therapy, say for back pain, or are there procedures, injections that could be done? And also the fact that acupuncture and things like that are not necessarily in the forefront of our minds. Insurance companies also need to help us be part of the solution to let some of these things which are considered non-traditional or maybe may cost more than a prescription. We need them to also be part of the conversation to help us find the best ways to help patients.
Yeah, because quite often someone's going to pay out of pocket for those kind of services and treatments because they're not traditional versus going and picking up a very cheap prescription.
Absolutely.
Okay, so we've got this table set up because you brought a device to show us one of the alternative methods that you're using, and you're dealing with people who are really in a fight for their lives. I mean, they've gone through surgery and maybe chemotherapy for cancer. So how do you tackle that while still limiting opioids if possible?
Absolutely. I think when it comes to surgery, and this isn't even specific to cancer patients, but pretty much almost any part of the body can have a nerve block done to potentially numb an area where there's pain. And so where we've had our greatest success has been with our mastectomy program. So it's obviously a very anxious time for patients, you know, having body changes. And so there's a lot of anxiety and stress going into the surgery anyways. And what we're able to do is place a nerve block, and it's not in the spine, which would be an epidural, but in where the nerves are traveling before they get into the spine.
Where the pain is?
A lot of times, so for a mastectomy patient, we would place it in the muscles of the back area. And so it's out of the area where the surgery is, and we can allow this very skinny catheter to be placed there. And we have the patient have surgery, and they'll be connected to a ball that's just full of numbing medicine. And the nice thing about that is, just like when you go to the dentist, before they do something like drill in your mouth, they'll put numbing medicine there, and then you don't seem to mind that they're drilling in your mouth. And so in that same way, if we can do something to numb where they're having their pain, again, can we have their after surgery experience be much better? And so we've had great success where some of the patients who've had a mastectomy have never taken a pain pill afterwards.
Well, and a lot of people have to get back to life, right? So there's not just the risk of addiction, but opioids do have a big impact on how you're feeling, how you're thinking, what you're able to do.
Yes, absolutely. You know, there's nausea, there's constipation, there's itching, there's sleepiness. And so the more that we can get that pain managed, the less the patient is going to feel maybe kind of distant from their family. They go back home, they can be part of the family, and of course they have to be mindful that they've had surgery, but can they really feel like they can be there for their children or be there with their significant others? And so we want to try to do everything we can to make them feel like they're as normal as possible after surgery.
Treating the entire person.
Absolutely.
Dr. Iyer, thank you so much from the Cancer Treatment Centers of America. You can contact the hospitals and offices for more information about treatment. Thank you.
Thanks for having me.